Dr. Chertak, I've got this pain in my hip and the medication's not working, the therapy's not working anymore. What is the next step and what should I be prepared for?
Well, unfortunately, the next step is probably a hip replacement, a total hip replacement. And what you need to know about hip replacements before you get into the aspects of the surgery itself is that it takes about 60 to 90 minutes for the surgery. It's an inpatient procedure, which means you're a patient in the hospital for 1 to 3 days after the surgery. More severe disease requires usually a longer hospitalization and may take a longer time for the surgery. You may not be driving for 3 to 4 weeks after the surgery. If you have a desk job, you can usually go back within a week to 3 weeks. If you have an 8-hour-a-day standing job, it may take you up to 2 months before you're going back to work. And an 8-hour day where you're walking, twisting, carrying, lifting, it may be a full 3 months before you return to work. You need to line up your family support networks, people who can bring some meals over for you, somebody who can do your laundry for you, and somebody who's there to take you back and forth to the hospital, back and forth to doctor's offices and therapy. Outpatient therapy you'll probably be doing 1 or 2 times a week after your discharge either from the hospital or from a rehab facility. Do you need to go to an inpatient rehab? You may have enough support networks at home, you don't need to do that. You'll need a raised toilet seat for most hip replacement surgery, cane, crutches, and walker, which the therapist will help you decide, a grasper, which you might be able to borrow from a friend who has one, higher chairs with armrests, Queen Anne chairs, sock helpers, shoe horns, especially the long handle kind, are really come in handy. And then you have to look at whether or not you need a medical evaluation, and you should always see your dentist before the surgery, make sure you don't have any infections. That's preparing yourself for the journey of a hip replacement. And then we'll talk about the surgery itself.